Okay, everybody, welcome. My name is Mark Malcolmson. I'm principal of CityLit, and on behalf of all of my colleagues, I'd like to welcome to you this session about reflections on the state of mental health and well-being over the last 5 years. We have two of the most wonderful panelists who are joining me, and the three of us are going to have a hopefully lively conversation over the course of the next hour. Just so you know, just a little piece of housekeeping. Usually I have to tell you where the fire exits are, etc., when we're in person, but this year it's a bit more mundane in terms of, because we're in broadcast mode and we've got a kind of panel going on, it's difficult for us to do the Q&A with people being muted and unmuted, etc. So what we're doing to make things easier is if at the bottom of your Zoom account, you can click on the Q&A box and have that there. If you have questions, could you type them in to the Q&A box, and then I will keep an eye on that. I won't necessarily be able to ask the questions immediately they happen, but I'll try and weave them in as the conversation develops during the course of the next hour. So that's Q&A, not the chat box. The chat box is a different function, so we're keeping it to the Q&A for ease. If there's any logistical questions, I've got a couple of colleagues who are going to try and help sort those out. But if you actually have questions for either Paul or Sheila, then I'll do my best to sort of incorporate them in. Before I kind of introduce my guests, I kind of just want to take a step back for a second. This is our 6th Mental Wealth Festival. The first 5 were in person. They were held in CityLit's main building in Covent Garden. They were held at the National Gallery, in the Houses of Parliament, the British Museum, the Guildhall. We over the years had lots of physical venues and lots of partners. The partners have continued, but this year, for obvious reasons, we flipped the whole festival online. Now that's created a whole series of logistical challenges and various things where my colleagues have done an amazing job of keeping the wheels on. But it's also given us an opportunity to really rethink where we are in terms of participants. Last night we had Dr. Uma Naidu from Harvard Medical School talking about nutrition and mental well-being. We've got people from all over Britain attending. So this is no longer just a London-centric event that was, if you were lucky enough to be able to kind of get physically into London, you were able to attend. Now we've been able to go way beyond that. So that, we've got to have a little look and see what the silver linings can come from what has been a very difficult period. The positive around the festival has been that we're hopefully reaching more people with the 50-odd sessions that we're running during the course of this week. So thank you for joining this one. And this one is interesting for us. I want to just kind of rewind about 5.5 years. Sheila Hollins is a fellow of CityLit. That's hopefully a prestigious award. She was appointed with a number of other very prestigious people, including Princess Anne, Andrea Levy, Lulu, Gillian Anderson. So we've had a really wonderfully eclectic group of people who we believe have contributed hugely to the education of adults in Britain and has a connection with CityLit. And Sheila's connection initially was around our work with learning disabilities, and obviously she is a huge champion in that area in Britain around the well-being of adults with learning disabilities, and she speaks on the behalf of them in the House of Lords as well as many other venues. But we were just having a coffee, and she said, I've been having this idea for many years and I can't find anybody who's willing to be mad enough to partner with me on it. I'm really fed up with mental health just being talked in a deficit model about it's about stigma, it's about problems, it's always about the negative side. And of course, that's a big part of the challenges around mental health. But there's a huge positives around people's well-being, and we should be talking about both deficit and positive measures. And I'd love to use the phrase mental wealth, and I'd love to have a festival about it. And in a way, nobody says no to Sheila, I've come to the conclusion. And I sort of said, well, why not? Normally what happens in September is the college, as we get going, is relatively quiet. So why don't we put a couple of days on? And we co-opted a few of our colleagues at City Lit and Beyond Words, the charity that Sheila's the founder of. And we kind of did a small group of events. They all sold out. They're all very popular. And at the end of it, we decided, well, we've obviously got something here that's kind of got traction. And why don't we try and do it again next year? The next year, we had Ruby Wax, who's part of this year's festival again. We had Alistair Campbell. We had Hugh Grant. We had a number of MPs. And it kind of grew. And each year, we've had more and more people. Paul has been a wonderful participant in many of our festivals, and our partnership with Mind is hugely important to us. So as time goes on, we've ended up from a literally throw it in the wall and see if something sticks, to something that has actually become a thing. And where we've got support from the Mayor, Sadiq Khan, we've got all sorts of different people from all aspects of the mental health arena being involved. So when we were talking about the agenda for this year, we thought about various positives and various ideas that we could do and various sessions that we're repeating and various new sessions. But what I wanted to do is kind of bring the two people that I think are closest to me in the festival, and take a step back and reflect on, this is the 6th festival. It spanned 5 years. 5 years seems to be the right amount of time to reflect on what has changed and also what we want to change. I feel a lot has happened in the last 5 years around mental health and well-being, but the journey is still massively longer to go. So what I'm going to do is divide the session into kind of 3 bits, and we're going to be quite flexible about it, and it is a bunch of old friends kind of getting together, so we're hopefully going to be not too formal. But what we want to do is talk about the 5 years. What are the landmarks that we've had? What are the positives that we had? What are the challenges? Then we're going to kind of come to the present, and the present, I mean really the last 6 months of the pandemic and probably the next 6 months. And we're going to look at this unique period in history, and we know so many of the challenges it's created society as a whole, but we're going to look particularly at the perspective of mental health. And then hopefully we're going to look forward and talk about what we would like to see change in the next 5 years. It's almost a kind of, I was just talking to Amber, who's been masterminding a lot of the festival, and we were joking, going, it'll be our wish list of what she has to do for the next 5 years. So she lost color and muted her screen very quickly at that point. That's where we're going to go. As I said, I'm sorry, I've sort of half introduced each of you. Baroness Sheila Hollins is a crossbencher in the House of Lords, British Medical Association, Royal College of Psychiatry. I mean, just an amazing array of achievements. The one that's kind of closest to us is we partner so closely with Beyond Words, the charity she founded, I think 30 years ago, Sheila. And she, as I said, is the founder and the patron of the festival, so no better person to be involved. And then Paul Farmer. Paul is chief executive of Mind. Mind is obviously so well known in the country as a whole around mental health and well-being, and not only supports people, but sets a really positive agenda of things that need to be done. So there's research elements, there's proactivity, not just support mechanisms. So Paul is one of the best people I know about talking about the things we need to be doing and kind of setting a very clear agenda. So between the two of them, I'm quite a novice at this. So I just feel that over the last 5 years, I've got more and more involved and more passionate about this subject. So I will often defer to the two brains of the bunch. I will be the bun and lettuce to the double whopper of intelligence that surrounds me. So first of all, that reflections on kind of where we've come. So Sheila, if you'd like to kick off, and then we'll hand over to Paul.
And you'll just keep moving us on. Well, look, I just want to go back slightly further because somebody's asked a question about what's the point of raising awareness, and I just want to really touch on that, because when I first went to the House of Lords in 2010, I was very aware that mental health wasn't much talked about. It had been in terms of mental health legislation, but whenever health was talked about or illness was talked about, it was always about physical illness and physical health. And when the 2012 Health and Social Care Act was passed, leading up to that, it seemed to me that the only thing I could try to do to improve it was to try to achieve, in law at least, parity between mental and physical health. And I did that by going around talking to people, and other people, of course, contributed hugely to doing that. And I got an amendment in which health included physical and mental health, and illness included mental and physical illness, okay? And the point about that was to say, but the point about it was that to begin with, people didn't have the words, they didn't know how to talk about it. And gradually people did. And actually 4 MPs in the House of Commons stood up and spoke about their own mental health, their own struggles, in ways which were really, really helpful in terms of raising awareness and hopefully then leading to opening the way to more investment in mental health services. And I think Paul can say more about that and what's actually happened, because he's been so deeply involved in trying to deal with the practicalities around it. But I think talking about it really, really matters. And that's really behind my idea of talking about mental wealth, because, you know, as a psychiatrist, a former psychiatrist and an academic and you know, a policymaker and so on, I've been to loads of conferences and talked to lots of professional people about some of these issues, as well, of course, having been a clinician. But the idea of mental wealth, that the fact that we can actually build, you know, focus on, think about how to keep ourselves mentally well, how to be able to live fulfilling lives, to do the things which actually kind of are going to help our lives feel well, more fulfilled. And if we do have a struggle with our mental health, that we feel confident to be able to go and talk about it. I think that discourse, that conversation needs to be a much wider one. So the idea of having a mental wealth festival was that it wouldn't be about professional conversations. It would actually be an opportunity where anybody and everybody could come and talk. And at our first Mental Wealth Festival, I can remember the access being quite extraordinary. And I mean, that's continued. The digital access may indeed preclude some people. It will widen it to many more, but it may preclude some of the people who are able to come off the streets, including homeless people, a lot of people who may not have access to the internet, but who came off the streets and sat side by side with others who had a professional or academic interest and were able to engage in kind of conversation, activity, just discovering the kinds of creative things which contribute towards our mental health. So that notion, that was behind it. It was really about trying to get everybody talking, which I think is probably a good point to bring Paul in, because, you know, that let's talk about it really, really matters.
Thanks, Sheila. And yeah, good. Hello, everyone. It is a good opportunity, isn't it, just to take that step back and think about, you know, that progress that's been made over that, as you say, that's really that sort of 5 to 10 year period as much as any, where I think we've seen, it's interesting, Mark, you used the word popular. You know, as soon as you started the Mental Wealth Festival, and, you know, full credit to you and to Sheila for getting this off the ground and making it work so well. But literally the moment you initiated it, it was popular. And that's because we know that remains a significant appetite amongst people to think a bit more about their mental health or their mental wealth, and to understand it a little bit, to try to understand it a little bit more. And that appetite was unfulfilled because people weren't talking about it in any space, whether that be in Parliament or in workplaces or in schools, or in the media, where all you really saw were very negative headlines about people with mental illness being dangerous, or that was the only kind of narrative that was taking place. I do think that has changed. And in fact, we know that from the work of the Time to Change campaign, which has tracked public attitudes over the last 10 years or so, that in fact, absolutely slowly but steadily, public attitudes around mental health have improved. And like Sheila, I completely agree that that's been because people have been more open, talking not just about their mental health problems or their mental illness, but also increasingly talking about what it is that keeps them well mentally, what it is that you can do to look after your own mental health. And so as people started to talk about it, and we're coming to up to Halloween, it's October now, we're coming to Halloween, my least favorite time of the year, because you can bet your life that some manufacturer somewhere will manufacture a kind of crazy psycho costume. Now, when Asda tried to do that a few years ago, not that long ago now, but a few years ago, people with their own lived experience of mental health problems and lots of other people said, no, don't do that. That's completely ridiculous and stigmatizing. And after a lot of, well, actually after only 2 hours of activity, the costume was pulled. So, we're sort of starting to see these kind of small changes. And I mean, I'm sure we will see that again this year, but I bet you it won't be from a major supermarket. So people are being more open about it. The media now publish more non-stigmatizing articles about mental health than they do publish stigmatizing articles. And although it's not perfect by any means, they are, they've heard the appetite for people to think about how to look after their mental health and well-being, and down in no small part to people like Sheila, but also influenced by the media, the politicians are also beginning to get the message, and so I think we can be quite positive about some of the progress that we've made, and perhaps the best example of that has been the progress that's been made in workplaces, where we know that in a lot of particularly larger workplaces, not so much, it's a bit harder in smaller workplaces, but particularly in larger workplaces, organizations are really taking the mental health of their staff seriously. And they're doing that not by simply thinking about the people who are unwell, and that's important, but they're also thinking about how you help people to thrive at work as well. So there's a kind of broader piece going on. Are we there yet? Well, no, and we're not there yet, partly because that parity that Sheila talks about, we're still some distance from achieving. So people's experiences of mental health services are not where they should be. We're not there, I think, when it comes to understanding some of the complexity of people who live with more serious mental health problems. Sheila's been so passionate about the relationship between the mental health of people with learning disabilities, and that also applies to other groups of people as well. And I know we're going to come on to this in a little bit, but I think there are particular communities where people, I'm thinking particularly about Black and African Caribbean communities and others, where the stigma and the challenge of getting access to the right kind of help and support is still very significant. So progress, yes. Are we there? No.
No, so I think, can I unpack, you both brought up brilliant things, is the position of the a couple of the questions about saying, is raising awareness enough? I would say, no, it isn't enough, but it's a damn good start. So I would say 5 years ago, it was still very, very hard in most workplace organizations to talk about mental health and well-being in anything apart from cursory aspects. I think that's changed quite a lot. You're seeing a lot of advocacy groups within, as you say, the big employers have got so much better about this. You've seen Lloyds Bank, you've seen a lot of the consultancies kind of moving and really opening up about this. I think I'd be intrigued to what you both think about the power of celebrity. Ruby Wax, as I said, has been a huge part of the festival over recent years, and she took part in the second one for her first time, and she was like, if it's going to be me, Alistair Campbell, or Stephen Fry, that we're the only three that really talk about this. And yet now there are so many people, from the princes to some of the politicians, etc., talking. And what do you think that says to people who may be struggling on their own? Has that been as big a thing, or is that a little bit of pop celebrity that's actually quite trivial? So whoever'd like to kind of have a think about that.
Well, we know, it's a really good question. I mean, we know from the work that people like Professor Graham Thorncroft do in tracking public opinion and also what works when it comes to raising awareness and influencing. And of course, it's not just, I suppose it's just very important to say, this is not just about influencing, raising awareness for awareness's sake. This is mainly about not sort of three areas: knowledge, attitudes, and behaviours. So this is all about what do we know, what do we think, how do we behave? And we know that celebrities definitely play a role in helping people to think about all three of those: the knowledge, attitudes, and behaviour. Ruby talks to us about herself being the first poster girl for mental health, and we know that people in the public eye definitely have played an important role in shifting attitudes, but they're not doing it on their own. We also know that just as much, there's an equal amount of impact if that kind of conversation comes from your peer. So if it's whether it's a member of your family or a friend or a work colleague, then that has just as much impact on influencing your attitudes and behaviour as a famous person does. Does a famous person add momentum to a cause? Absolutely, because it attracts attention, and in a world where attention is very difficult, very hard to get, it creates a moment in time for us to focus and concentrate on the issue of mental health. And whether it's Duke and Duchess of Cambridge and Prince Harry or other people in the public eye, it's creating an opportunity and to focus people's attention, and that's worthwhile in and of itself, I think.
I mean, can I just add to that? I agree with that. But can I add to it that in a way, what I think celebrities do by is to gain the airspace, and so they can be role models, either talking about their own personal experiences or experiences in their families, but or in the compassionate way in which they talk about and are able to talk about mental health. So it's that thing about being able to move from not knowing how to talk about it. It's like not having get well cards that kind of are really appropriate for somebody who's struggling with with depression. I mean, that's changing, but it's about how do you actually behave towards, how do you, and seeing other people doing that in the media, whether it's through a celebrity talking, whether it's through a storyline in a soap, wherever it is, because that can be really, really powerful, because you can begin to model good ways and not so good ways of behaving towards family members, friends. So that's one issue. Sometimes people don't realize that what they're doing is showing good ways of being with people who maybe have got a struggle with mental health at the time. Hugh Grant, you mentioned, Mark. It's quite interesting. When we invited him to talk in a seminar on mental health and the media, he sort of said, look, I don't know anything about mental health. But actually, he knows quite a lot about mental health, because what he did, he set up Hacked Off, which was to support the victims of press abuse. And most of the people that the organisation is supporting are people who've been traumatised, actually, by the way the media had behaved towards them, by intrusion, by harassment, by exposing things that have happened that perhaps they're ashamed of, or didn't want to be exposed to the whole world. And he has the most lovely way with people. And discovered in himself the capacity to be able to reach out to all of those people. So we had a brilliant seminar in the House of Lords where he spoke. So sometimes people don't know, but they still act as role models. in the way that they are able to make themselves open. And I suppose the other thing is, I mean, Paul, you talked about it's not just celebrity. No, I absolutely agree. But there is something about this current world where we're on Zoom or, you know, Skype or whatever with work colleagues, for example, if we're in work or with family, you know, are we able to allow any of our own vulnerability to be shared, which then allows other people to share their vulnerability? Or do we just present the, as it were, the television face? You know, are we able to be real people and to pause and to notice, you know, and is that sort of watching, waiting and wondering about the other person? Is there something there? Do I need to reach out? Shall I phone them later? Can I say something? Can I talk about? Sometimes saying, I'm struggling a bit at the moment, can really help somebody else to open up about their own struggles. So, yeah.
I think that just my observation is the ability to have that conversation. I think there's a permission element by the media talking about it more, because it is slightly abstract. I'm not a member of the royal family. I'm not a football player. I'm not a soap star, but actually they are talking about it in the same way as they're talking about other things. So therefore there is a piece of, I'm not alone. And therefore I think there is a trickle down effect to going, well, actually, did you see Prince Harry on whatever program last night talking about that? And then there'll be the water cooler conversations, which I think do bring the conversation on. And I'm looking at a number of the questions here, and I think is awareness is the starting, because if people aren't, if it's not in the common currency of conversation, if you're not willing to talk about things, you're not going to be able to start to deal with them. So it is a classic thing of, you know, society starting to have conversations, which means the conversations get better and better in quality. I mean, one of the things we've done in each of the festivals is have a topic or a number of topics. And I remember 2 years ago, we had our parliamentary event happen to coincide with National Suicide Prevention Day. And we had a phenomenal panel of MPs, and it was great. It was literally one from each of the major parties, and it was in a world where politicians don't agree on much, there was a real kind of commitment to this is not about politics, this is about us making the world better. And Sheila had asked me to sum up, and I was thinking, well, I know nothing about this, and what am I going to say? And I'll just thank everybody and stuff like that. And about 3/4 of the way through, I'm going, okay, actually, my uncle committed suicide 20 years ago, and I still don't officially know my uncle committed suicide. My mum and my aunt kept it secret. He died, the official version still is he died in a car crash, because for their generation, it is a point of shame. And I've just made a sin that I apologize for, because I've used the phrase committed suicide. One of the things I learned that day was, it's been ingrained for me 50 years, is it goes back to committing a crime, which of course it isn't. But he took his own life because he was distraught, having lost his partner in a car crash the year before. And that was the first time I'd ever talked about it. And so I think the permission piece is hugely important on an individual level, to be able to kind of have that. And for me, that was a really important part of my journey around just something around our family. One day I am actually going to get the nerve up and actually bring it up at a family get together, but I haven't quite got there yet, because it is a journey. So it goes on about awareness is a stage, and then you build on that awareness. But if you don't have awareness and you don't have that common currency, then really the rest of the conversations can't be built on. I'd just like to go back to the point you brought out, Paul, which was the change in awareness around the workplace, and what you've seen in terms of good practice out there about what are people doing that's good, and what's worth copying.
Yeah, well, I think when we produced a report for government, which I did with Lord Dennis Stevenson, called Thriving at Work, produced for Theresa May, if we remember her as Prime Minister back in 2017, we sort of tried to take the best of the best from what we had at that point, and we identified this sort of triangle of activity. So what can you do to help people to thrive in work? So in other words, be mentally healthy and think about what the things that you can do to look after your mental health in a positive way. Secondly, what you can do to support colleagues who might just be struggling on those, either short term or longer term. And then thirdly, what you do to support people who are unwell and need help and support, probably often in clinical terms. So I think what we've seen since then, has been a really impressive set of approaches by many organisations, and they're large, medium, and small. They're in different sectors. They're all, there's a very impressive sort of vanguard, really, of companies. And what they, we think we're beginning to get some sense about this sort of active ingredients about what really makes a difference. And it, broadly speaking, boils down to three things. One is the leadership. Organizations that don't have compassionate leaders, people who recognize and give permission to people to talk, it'll be very difficult for that organization to thrive in this sense. Secondly, equally, having people who are champions in some form or another, and a whole variety of different approaches, whether that's mental health first aiders or workplace wellbeing champions or others. And then thirdly, I think we've seen from the Mind Workplace Wellbeing Index, which now over 100 companies do every year. The other element to this is a sort of core sort of backbone almost of organisations, whether that's in the way in which you have your policies or the way in which you run your meetings. And I think there's been something, and I know we're going to come on to the whole Zoom culture in a minute, and Sheila mentioned it earlier. I think there's been something, very positive about this from many workplaces, because they've actually got to see their leaders, bedrooms and their toddlers and their dogs and their cats, and it's made people look a lot more human, in fact, and I think that's been a good thing, and that's been one of many elements that we think we're seeing from workplaces more generally. And workplaces have been the engine room, really, of changing adult public attitude, and in many ways, because there's work that we've been doing in the charity sector. But it's really the workplaces and obviously work now going on in schools, but the vast majority of us won't have ever had any mental health education at school. So what's the place where most of us spend a lot of our time? It's in the workplace. And that's also where I think, relationships with organizations like yours and education institutions as well is going to be really important going forward.
That's great. I was just going to turn to you and ask you, what government had, you talk about 2012 and the Act, but also the appointment by Theresa May of Minister for Loneliness, which I think was one of her great contributions, actually. And we had Baroness Barron, who was the Minister of Loneliness last year, speak at the festival. What are you seeing in terms of Parliament and government and the progress that's been made or not made over the last 5 years?
Well, I do think there has been more attention and more concern about loneliness. And one of the things which is really interesting is much more interest in mindfulness, for example. And one of the reasons for that growing is because actually there's been huge numbers of parliamentarians have done mindfulness courses in Parliament. And therefore there is talk about it, knowledge about it. MPs beginning to want to see mindfulness being taught in schools, for example. So again, it's part of the whole workplace phenomenon. I suppose the difficulty that I have is that whenever these initiatives happen, they quite often don't really affect or consider the needs of people with learning disabilities, who are the people that I've really spent my working life trying to understand and support in one way or another. And they are sometimes seen as some of the loneliest people in society. And actually the pandemic has probably made that even more so. They're also a group who have a very low rate of employment. Less than 6% of adults with learning disabilities have a job. So this idea about being in the workplace, and the workplace being a place where, you know, if people are kind of good and kind to you, you have an opportunity of, you know, building, you know, your mental wealth. The health inequalities which have been spoken about, Michael Marmot's work on health inequalities and the social determinants of health, which includes mental health, is incredibly important. And people who are not going to benefit from the sense of belonging that comes from, you know, having a reason to get up in the morning. And it's one of the biggest things, you know, I always talk about the 5 things we can do for our mental health every day. And one of them is actually having a reason to get up in the morning. It's having something to learn and, you know, to be creative about and so on. It's why City Lit is so important. You know, it's a place where you can go, you can do something creative, you can learn a new skill, and you can meet people. So there's having a reason to get up. There's having people who know you, you know, who to engage with. You know, what I call a hug a day. It might not be a physical hug today, but even just the being able to hug each other over Zoom, you know, kind of helps. But the notion that there is somebody who kind of knows when your birthday is and how you'd like to celebrate it, or just troubles to make contact with you, really, really important. But it's also about having something to give in your life, you know, something that's appreciated, where you're giving, contributing to society. Everybody needs to do that, as well as being able to receive. You know, these are really, really important things. And yes, of course, eating well, you know, the importance of nutrition in our mental health, being active and so on, that matters as well. So this notion of loneliness, and I thought the having a Minister for Loneliness was a brilliant idea. I really, really approve of it. But then we have to think about everybody, absolutely everybody. There needs to be almost a curriculum for life, which helps you to to understand the different elements that are going to allow you to flourish. And being lonely is kind of, it's not a good state.
No. And actually, in a minute, when we come back to, we start talking about the now and the pandemic, loneliness is probably one of the biggest epidemics, I think, that has happened. It's accelerated a whole period of isolation for so many people. Can I just ask, in terms of, there are quite a few questions in the chat line about, you know, we're talking about general awareness, we're talking about the narrative within society about mental health and well-being, but support and services. Part of this is a kind of a chicken and egg thing. Unless people talk about it more, then you won't get people kind of saying, I need help and support. But if there isn't the support and services there to give them the help and support, are you dangerously opening up something that makes the situation worse for people? How do we feel that whole support element, whether it be in the NHS, whether it be in the charitable world, is it getting better, or is the increase in demand outstripping the need?
That's a 45-minute question, Mark. But in shorthand, I think we can absolutely point to you know, increased investment in a number of areas of mental health services as a result of the 5-year full review for mental health, and now the long-term plan, which does mean that there is a greater degree of availability for, whether it's for talking therapies, which is actually in many ways a world-leading service in terms of the number of people who are able to access talking therapies on the NHS, or indeed for more specialised services where we've seen, you know, improved capability for access in areas like perinatal mental health, for example. But I think it comes back to where there's kind of two connected issues. The first one is we have to carry on talking about the issue, partly because this will help us to understand what we can do to prevent a mental health problem happening. And so it's a part that the awareness is not just an understanding piece, it's also it's also enabling people to play a prevention role, particularly when it comes to some of the more common, in inverted commas, mental health issues. But secondly, I think it also highlights the task that is still in hand. And when Sheila initiated the parity clause in the Health and Social Care Act back in 2012, that absolutely kind of led to further investment in mental health services. But we're still a real distance away from people's experiences of physical health care. And so the classic example of this is amongst children and young people's mental health, where the sort of the reach is roughly about it's currently 1 in 4 young people get the help they need. The additional investment will take that to 1 in 3. So that's good, that's progress, but it's nowhere near where we need to be in terms of people's experiences. And now I think one of the things we're currently seeing is that as people's awareness and understanding of mental health generally grows, they then find it people are really kind of finding it very hard to believe that it's so difficult to access the help and support that you need. And this is in no way a criticism of NHS mental health services, who work incredibly hard to try to provide the help and support that's needed. But the long-term plan has to be fully implemented, because if you're going to have for example, the number of clinicians, doctors, nurses, psychiatrists that you need, you do have to take a long-term view. In fact, just 2 or 3 years before that clause was initiated, the government of the day decided to flatline investment in new psychiatrists, and because that was what their projections were telling them. And so it takes quite a long time to actually rebuild that up. Now, thanks to the great efforts of people like Sheila and successors in the Royal College, actually, and also that increased awareness raising, more people now want to come and work in mental health. More people want to be psychiatrists and nurses and peer support workers, and the amazing graduate and the amazing new kind of fast track mental health social work program called Think Ahead, which is able to offer, I think now, 150 places for people who want to become a mental health social worker. I think they had about 15 to 20,000 registrations of interest last year. So people want to come and work in mental health, and we now need to make it, we need to create the jobs for the right people to be able to come in and fulfill and meet the needs that we know so many people have. So it's in many ways, we're on the tipping point of going, as a result of the increased awareness, of getting to a point now where we can really ensure that the real change that is needed in services is truly delivered. But we're some distance away from actually achieving that yet.
That's amazing. That was a 45-minute answer, beautifully truncated into a much shorter thing, but you get so much food for thought. Anything you'd like to add, Sheila?
Well, I suppose the charity I set up, Beyond Words, has been trying to help develop conversations directly with people with learning disabilities, and to empower children and adults with learning disabilities to be able to talk about issues, including mental health issues, including conversations about death and dying, about abuse, about trauma and loss of different kinds. And I suppose for me, part of what needs to happen is also making sure that the self-help opportunities increase and grow. And all we do actually is to sort of create picture stories, which for people who find pictures easier than words. And whether it's Son is feeling sad, or Ron's feeling blue, or whatever it is, the idea is to encourage and enable people themselves to be empowered, to understand, because I think the understanding is so important. So I think it's really, really key that we have a growing number of professionals working in mental health services, and that there's investment in the proper training and then the development of services. But alongside that, I think the sort of self-help side of it, the empowerment that people need through the discourse, the conversation, matters as well. So I would just say that needs to go in parallel, really. And also, you know, there is now a requirement for schools to attend to social, emotional, and mental health for children in schools, and for schools to have a mental health lead. And my charity's been doing some work with teachers, again, to think about how, you know, through running feelings groups, but using pictures as a prompt for communication, can help children to begin to learn to talk about their own experiences of anxiety, stress, depression, loss, whatever it might be, in order that they also become kind of confident communicators around mental health. And I think this is, so I think a lot has changed, actually.
That's great.
Not enough, but a lot.
No. Which brings us on, I'm realizing we've kind of spent quite a long time talking about where we've come from, but I think it is important. Can we just spend a little bit of time talking about the now and what has happened over the pandemic, which is obviously where we had this kind of lull in the late summer, and now we seem to be slipping back in terms of lockdowns or mini lockdowns, etc. Observations from both of you about the effect it has had on the mental well-being and of the country as a whole, both on a kind of individual or kind of group basis.
Well, can I just follow on from what I was saying already, because you know, because it's sort of linked. So my charity has never really seen itself as really a direct kind of engagement charity, not hugely. We've always run some book clubs in libraries for people who prefer reading picture books, adults, and in schools to some extent. But during the pandemic, we realized that communication directly to people with learning disabilities was really not there. The message was not clear. People didn't understand. And actually right early on in March, my son, who has a learning disability, and he's an autistic man, as you know, he got COVID and he didn't understand what was happening at all. And so the charity actually started creating free resources in pictures to try to communicate to people who weren't really being kind of helped by the current messaging. We've actually created 15 different resources covering a whole range of things. The first one was Beating the Virus, which is about what happens when you get it. How do you look after yourself and how do other people support you? Particularly perhaps if you're living alone, as a lot of people do. But we also included things like planning ahead for coronavirus. Jack plans ahead for coronavirus. You know, what do you need to do? If supposing you got ill, supposing you had to go into hospital, what could you expect and what would your support worker and family expect? Or a guide about what happens when somebody dies from coronavirus with some picture stories. We also did good days and bad days in lockdown. My son said to me, "You can't tell me not to go out." He began to realize that actually it was Boris who was saying it. But, you know, it was really difficult because actually I've always encouraged him to make some of his own decisions, and they're difficult decisions. But the lockdown, the bad days in lockdown were quite bad. The good days had to be created by creating new routines, new structures, new ways of living one's life. Quite hard, you know, to do that. So we decided just to create free resources. So we did it. And they've been downloaded all over the world because they're in pictures, they're not language dependent. And it's just been very, very hard work. We have managed to raise some money to support us, quite hard to begin with, but we've done that. And I think it's been something really extraordinary that we've succeeded in doing in order to help people. People have been lonely. Some people are now able to join our online book clubs, but of course that's dependent on them having a tablet or a computer to be able to do it. And not everybody has one. And, you know, that's tough.
Poverty, I mean, that's what I think what we're hearing from councils, from government, from charities is digital poverty is actually a huge problem.
Yeah.
compounding. There's more than a financial divider. It's actually a social divider of massive proportions. Paul, your observations to build on Sheila's.
Well, I think Sheila highlights, you know, a part of the reality of COVID, which was people who were, who are still too marginalised or disadvantaged or impoverished in some way, shape, or form, have had to have borne the worst of COVID. You know, people in particular Black and ethnic minority communities where the impact of the virus on their community, on their families and on their lives has been very profound. People in, you know, people in abusive relationships who have found nowhere to go. People who are obviously increasingly now are going to be affected by the economic consequences of it. You know, I think I think some of these are, this is shone a light on on so many existing inequalities, and that also applies to people with more serious mental health problems who we know struggled significantly during the period for a whole variety of different reasons, but also were really affected by the virus and the lockdown and the consequences of all of that. And the other kind of groups that we've been thinking, so we've thought a lot about how do you support those groups, and done a lot of work in that area, particularly through the amazing work of our local minds, you know, who are in those communities working and supporting people. But I think we've also thought about two other groups. The first group is those people who are at risk of developing mental health problems as a result, as either direct or an indirect consequence of COVID. And particularly, we've thought about frontline workers, you know, people who are exposed to trauma in a way that they wouldn't have necessarily been otherwise, or in a very different way to the way in which they've been used to. One of the things we set up was the Our Frontline initiatives. A bit like Sheila, I think one of the the positive side effects of this crisis has been things that used to take you months and months, you were just doing days. And we set up this service with Samaritans, the crisis tech service Shout and Hospice UK, to provide a kind of front door really in for people who are working in frontline services, whether in NHS or social care, or indeed in other frontline services, bus drivers, factory workers, etc. We've had over 150,000 people contact us since we set that up in May, which I think reflects that kind of sense of need. Amongst the general public, the data suggests that the public generally coped probably rather better than everybody was expecting. And I think actually that comes back to at the start of our conversation about better awareness and understanding. So when the lockdown started, we were absolutely inundated with people wanting to download our how to look after your mental health during coronavirus material, similar to Sheila, millions of downloads. And I think that was a sign of the work that had been done by many people to build better awareness and understanding, so that when the lockdown did start, people thought about their mental health and started to seek help. So the sort of the data that's been piece of work that's been done by UCL over the last 6 or 7 months is suggesting that the public's well-being has more or less held up quite well. I think we are quite worried about whether that will continue to happen, because I think there are some elements of what's happening now, both the economic dimensions of the virus, the meteorological dimensions of where we are at the moment, as well. I think could well play its role and take its toll on people. So I think we are increasingly worried about the sort of public mood, if you like, and public's resilience, really, I suppose, to be able to cope. But you know, again, I think the other positive has been this sense of people getting together and finding ways to support their neighbours, their communities, both, you know, locally in terms of the way that those local communities have been set up, but also virtually using, using this amazing technology. And we too worry about the digital exclusion issue. I think these kinds of things have been a lifeline to so many people, and have been very, very important to a lot of people. But if you don't have the broadband, you don't have the Wi-Fi, you don't have the data on your phone, because it's going to cost you money to be able to seek that help, we will get, that again has its impact on people who have been worst affected. And then just finally, a word about the phrase, what will almost certainly be the word of the year, which is self-isolation. Self-isolation is fundamentally not terribly good for our mental health. The ability to hug our grandchildren, or go out and play team sport, or just take part in those face-to-face interactions that you have in a whole variety of different ways. And although we're starting to get back to a little bit of that, don't underestimate the number of people who are still self-isolating to a very great degree. And that just is fundamentally not really very good for our mental health. It's not how we function.
And we haven't really thought about the people in care homes, the older people in care homes, who have suffered in two very particularly awful ways. One, the extent of COVID within homes for older people, but also just the isolation they have had, where their relationships and support and meaningful relationships have come more from staff, and where family carers, family members haven't been able to act as caregivers and to be regular visitors. And the pain of that, of not being able to see the person that you care for, has really had such a bad effect on people's mental health. Not just the people within the homes, but also their families, who feel so impotent outside and aren't being allowed to visit. And this is something that just we haven't been able to get around. And some of it's to do with fear of litigation, and some of it's to do with public health caution, and some of it's to do with not being able to somehow find ways for people to engage safely. And yet that engagement, the lack of engagement, that social isolation has had a devastating consequence on so many people's mental health. And I feel that, like so many of the people with learning disabilities I know, who've been, particularly people living in more independent living, who've just found it so hard to understand the messaging. One of the acute questions being asked was about whether a more compassionate leadership and a messaging such as that given by the New Zealand Prime Minister, which seemed to have been such an honest and straightforward and compassionate approach, whether that would have changed things for any of us. And I just wonder whether that tone of communication, one which was more about helping us each to understand, would have been better than the focus on rules and regulations. And I struggle with that. For me, understanding is such an important part of this, and I'm not sure that everybody understands. So that's been very much a focus for me.
I think you're right. I mean, it's interesting, compare and contrast. I often say to friends is that there's probably about 20 years worth of PhD sort of research material from the virus, whether it be from anthropological, medical, societal, I mean, literally every aspect of life. It's like an enormous kind of social experiment that's gone awry. And then you see on one hand the Jacinda Ardens of this world, to mention the New Zealand Prime Minister, and then you've got on the other end the insanity of last night on television with the American president. And you've just got to think of the effects on people's well-being and the people's support on that. I'm very conscious that I've done a very, very bad job of doing a third. We're now kind of like at the end of 2/3, but are now pretty much out of time. Can I ask you both just very quickly, if there's one thing, now this is just the killer question, this is the one that's absolutely not, if there's one thing that you'd like to see in the next 5 years us get considerably better at, is there a thing that you would like to pinpoint that if that got sorted in some way, or we improved in that, then actually we would make a big step forward?
Yeah, that's a tough question, Mark. I mean, I suppose in the spirit of the conversation we've just been having, compassion and empathy goes a very long way. And I think we're increasingly seeing leaders, and I'm mainly talking about, I think actually kind of bosses really, as much as anything else, realizing that compassionate leadership is a really important dynamic to changing the way that we want to think about that we want to think about ourselves, but also the way in which we're thinking about our workplace community and ultimately our society. And I think if we are, there's so much talk, isn't there, about rebuilding communities as a result of this pandemic. But if there is a positive to have come out of it, it is those acts of those, often small acts of compassion and help and support for our sort of fellow human being that has really made a big difference. And that in and of itself is an act that reflects, is about our mental health. It's about our mental health as an individual in making that act, but it's also about thinking about the mental health of the person who's sitting opposite you. So, I think, perhaps my question for everybody, or that's my exhortation for everybody on the panel, on watching this panel today, would be, write down 3 things that you can do for your own mental health, and then 3 things that you can do for somebody else's mental health. And if you could do that today, then that's the first step forward. There's loads of other things that I think we're going to need to change in terms of service provision and all those kinds of things. But fundamentally, the change that we've seen over the last 5 years has been driven by individuals taking individual action, and I think that remains the cornerstone of how we sort of complete this quiet mental health revolution that we've all been working on together.
That's marvelous. Sheila, thoughts?
Well, I mean, absolutely, I agree with what you've said, Paul. I think I have this real hope that we won't, when people talk about going back to normal, I hope we will have moved on just hugely, and that there will be a greater understanding of the things that have been good about the pandemic. I know it depends who's in your household, where you live, whether you've lost your job, whether you've been affected by illness, whether people have coped, managed, had the resilience, the resources, whether things have gone totally wrong, pear-shaped, as my son put it, in your household and your life, whether all of those kinds of things. But actually, there is the possibility that a better work-life balance is going to emerge, and that there'll be more focus on community, on less on financial wealth, and more on our mental wealth and our community wealth and our family wealth, more on those, and that we will have changed what we want, what we expect, what we're prepared to work for and want in our lives. That's what I really hope for in the years ahead, that there's been a change of focus, and that we're building back better is not about just focused entirely on the economy, just thinking about people as the central part of, why we're here.
I think both of you have done that last piece of just saying the individual and putting the individual in the center. I think that rebalancing is hugely important, because it is what you can do for yourself and what you can do for your immediate people is a very important building block in society. Obviously, there is support that's needed at a national level on very many other things, but I think you're right, is that what can I do and what can I do in my life? Those are the bits that I think people are grappling with. And I think Paul's point of, the fact at the beginning of the pandemic, there was a discussion very, very early on about what is this going to do for people's mental health, as opposed to it's something that wasn't discussed, is probably an encouraging sign in the greater scheme of things. Obviously, an hour was nowhere near enough. I want to thank you both for the last 64 minutes and your contributions, but actually, more importantly, I'd actually really, on behalf of so many people, like to thank both of you for the change that you've made to so many people's lives through the organizations you've run and the work that you've done at so many levels. I'm honored to know both of you, because you do make a huge difference, and this is an area that the world is a better place because of what you do and what the organizations you're part of. So both of you, thank you very much. I'd like to thank you everybody who's joined the session. There are obviously 3.5 more days of brilliant events that are taking place. So if you want to know more, CityLit website, citylit.ac.uk, and then just look for the Mental Wealth Festival. And hopefully you get to join an individual one of the smaller sessions, or actually one of the big panels that we've got over the next few days. Sheila is actually chairing a session on Friday around death and loss during the pandemic, which obviously leads on to some of the things we've already been looking at. And Paul's mind is, there is so much great resource there that we would actively encourage anybody that feels that they need additional support. Mind is one of the most wonderful set of resources I could imagine for any area, never mind just mental health and well-being. So both of you, thank you. And also Alison and Charmaine are wonderful interpreters who do an amazing job. And unlike the cookery session last night, where we were using phrases like beta flavonoids and things like that, I just love to see Charmaine trying to translate again. We've mostly kept in good language, I think, from a translation point of view. So thank you both for doing such a wonderful job. Paul, Sheila, thanks for everything. I really appreciate it. And take care. Take care, everybody. Thank you.
Thank you.